Len, these figures that we've got from the department, from the FOI, I have to say, pretty pathetic response, I think, at least, that we've got. It's the usual guff, isn't it? We're putting more money in, it's all going to be fine. You know, Mark, clearly very passionate with the campaign, and I think a very good campaign to raise awareness of this, if I dare say to you, Cinderella. Is that a fair description?
Yes, it is. I mean, I think we have a contract fundamentally that started back in 2006. It's a fundamentally flawed contract, and government after government, Prime Minister after Prime Minister, just have been sitting idly watching this dwindle on the vine. And Mark is absolutely right. But this predated COVID. People blame COVID for a lot of things. This predates COVID. It was happening anyway. Yeah. It's been underfunded. Structurally, the whole system is fundamentally flawed. If I explain how the system works, if I see a patient and I do a filling on them, I may get a certain amount of fee on the NHS. If I do 5 fillings, 3 extractions and 10 root canal treatments on that same patient, I get paid exactly the same. Okay, so that's completely bizarre. And that system has been running since 2006. It's not surprising that dentists are leaving in their droves. We've lost 3,000 dentists in the last couple of years.
I think this was, you know, when we first delved into this a couple of months ago, this was the one thing that I hadn't fully understood, was that thousands of people are leaving NHS dentistry, which partly explains why nobody can get onto a list. What would your advice be? I mean, let's take a family of 4, couple of young kids, and they apply to every dental surgery in the area, and every single one says, we are not taking on any more NHS patients. What do they do?
It's distressing. There is no answer. There is no answer. The answer falls with the government. So the 2 things that the government needs to do, the first thing they need to do is change the system. We have an activity-based system where targets are based on the back of dentists to hit targets. Healthcare and targets just don't work. It doesn't make sense.
This was Tony Blair's big idea.
It was, absolutely. But successive governments have continued to do exactly the same thing. Been watching. I've been in a pilot for the last 10 years, looking at the way we can change dentistry based on prevention. We are dealing with 2 preventable diseases, gum disease and tooth decay. Very preventable, and we should be investing our money in preventing disease, not treating it. So we've spent decades giving dentists money to treat patients with disease. We don't need to do that. We need to prevent that disease. That's the first thing we need to do, is change the system.
And is that education to a large extent?
It is it's education.
Regular checkups, education.
Absolutely. So the issue about people who are dying because of oral cancer is because they don't come to see the dentist, so they need to be coming to see the dentist. Now, we have a problem if they can't see the dentist in the first place because of access. But if they see the dentist more regularly, you need to pick up those things early on. And because of COVID, what's happened is people have gone to see the dentist, they've gone to the GP, they've just turned up in A&E. That's why they've been flooded. That's why there's an increase in numbers in tertiary care.
Is this one of those cases, Len, where we should be thinking, OK, we've got a problem here, and you say the system was badly designed back in 2006, but there are lots and lots of dentists out there quite happy to work privately. Is this a situation where we should be encouraging people through tax relief or whatever it is to go and get private dental care?
No, I mean, I think there are plenty of people who can't afford private dentistry at all. And we're not doing them any service at all to actually try and encourage them to go private unless you have insurance schemes like Australia and America. It's not going to work, basically. We live in the 21st century in a very rich country. We should have a very good NHS service. It's appalling that the NHS is the way it is. And it's because year after year, governments have just ignored the whole thing. It is, as you say, it's a Cinderella. And what the government has done recently is they've made some marginal changes. It's essentially just moving the deck chairs on the Titanic. It's a complete waste of time. There needs to be more activity from the government.